Greetings. My name is Evan Ashkin. I'm a family physician, and I wanted to talk to you about our Formerly Incarcerated Transition program that we are in collaboration with CCT. I had noticed the need to connect people coming out of incarceration with essential health services, as sadly, there really are no systems in place that do this. And a patient of mine that I was seeing in a community health center I worked at finally got me to pay attention to the gaps that people fall into. He was a gentleman that suffered from diabetes and high blood pressure, kidney issues, and had some cognitive deficits as well. And upon release from prison, was not connected to any medical services. And finally, an aunt brought him to see me after a couple of years, and he had suffered terrible complications that were almost certainly preventable. And at that point, I realized, we really failed this man. We failed his community, and started to look into what kind of services were available to link people, and sadly discovered that there really aren't. And the FIT program is based on a model where we hire people that are formerly incarcerated and train them as community health workers, and then they work with people upon release to actualize comprehensive reentry programs. So we understand that people need a roof over their head, they need employment, food in their belly, ID, all those things. But the lacking part in a lot of reentry has been this connection to essential health services. And we are thrilled to be collaborating with CCT, which hires and supervises our community health workers in our FIT program in Charlotte, and then collaborates with the Charlotte Community Health Clinic to get people into these essential services. So they're able to have a primary care provider, they're able to have behavioral health issues addressed. If they have substance use disorder, that can be treated, dental services, and the FIT program is actually able to cover costs at the community health center for those essential services and part of their medications. This has been a tremendously beneficial program. This type of program has been studied and shown to really have very positive impacts for people, reducing days of incarceration, which obviously isn't very important, but also really improved health outcomes where people have fewer hospitalizations, fewer needs to use an emergency room, and really show that they have a sustained relationship with a primary care provider, which sadly many people that have been in our criminal legal system have not had that benefit. So that's what our FIT program is, and we would not be able to provide the service if it wasn't for our partnership with CCT.